Welcome to the webinar. If you're like most people that come into our office or come to a seminar, you might have had your health problem for so long, or it's gotten so bad that you're thinking, you know, the only way I'm going to feel better is if I get a new body. And right now that technology doesn't exist. But what we're going to talk about today is the closest thing we have in your lifetime to regenerate parts of your body that have broken down or worn out from overuse or injury. And you're going to have a lot of questions about this subject. So the best way to get the most out of this webinar is to actually grab a pen and a piece of paper and write down any questions you have. Because at the end, we're going to tell you how to get those questions answered. So let's get started. Now, how many of you have actually heard of the miracles of stem cells, of people regaining the ability to use their body when in the past they thought, this is as good as it gets, or I'm never going to get that back again? Well, have any of you had them done yet? I'll tell you a little bit about my story as we go along. There's usually two reasons people tune into the webinar. Number one is you have a health problem that you hope stem cell therapy can help you with. And number two is you're just excited to learn about stem cells. So either way, you're going to get a lot of information today. Today is a day to be excited because for the first time in our lifetimes, there is a technology that you can get right now, today, that can not only help you feel better, but help you break that never-ending pain cycle of waking up in pain, spending your day in pain, and sleeping off and on at night because you're in pain. And today's an opportunity for you to learn about that and to change your life. Now, our purpose is to help as many people as possible, not only get out of pain, which is what you all want because you're suffering, but also to help you get your life back, help you get your health back. How many of you have noticed my shoulder's hurting, but you know what? Now it's my neck and it's my upper back and I'm cranky and it's hard for me to move around and do daily activities like wash my hair or get dressed without pain. Well, that's what happens with health problems is they start affecting more and more of not only our health, but our life. And my purpose is to help you eliminate that and to help you maintain your health for the rest of your life. People ask me, how long do stem cells last? And I tell them, well, you know, as long as it took you to break that joint down in the first place, that's how long it's going to take you to break this new one down. Now, 7 years ago, I had this therapy on my ankle and I was bone on bone from an injury that I had. Not only have I regained my ability to walk, I can stand on one foot, I can jump up and down, and I don't have pain anymore. And to me, that is revolutionary because I was thinking, by the time I'm 50, I'm going to be in a wheelchair. And I didn't want that. Now, regenerative medicine is a new way of thinking. So how many of you out there have knee pain? Probably a lot of you. If you're like the people that come to our workshops, 90% of you probably have something going on with your knees. And if I ask for a show of hands, you've probably tried physical therapy. Many of you maybe even had cortisone injections or the rooster comb or the gel injections in your knees. And what happens with those products is they might help you with pain. Now, many people tell me I didn't even get any pain relief with that. But here's the thing they don't do is they don't stop your joint from continuing to break down. So we call them degenerative therapies. That means that while you get relief, the joint is still degenerating. Like when people say you should move to Florida, you'll feel better. Well, does that regenerate your joints just living in a different climate? We all know the answer to that, and unfortunately it's no. Now, stem cell therapy is regenerative medicine. You're going to see x-rays of changes from people before and after they had stem cells, and you'll actually see their joints regenerated. So they develop new joints, they regrow the tissue that they've worn out or injured over time. Now, stem cells are called the body's master cells because they're what every part of you stemmed from when you were growing inside your mom. So they can become new cells. They can become new cartilage and regenerate your knees. They can become new ligaments and help your shoulders or your neck or your back if you've injured those in a car accident. They can even regenerate bone. So if you're bone on bone and you thought the only option I have is surgery, stay tuned because you may find out that there are other options. And that's my purpose for doing this workshop. In the end, you decide what's best for your body. It's my opportunity to share this information with you so you have as many options available as possible. Now, stem cells didn't just grow your bones and your muscles and your joints and your nerves, they actually created every single part of you. So stem cells are effective for treating brain injuries like dementia and stroke and Alzheimer's. They're even effective for blood disorders like leukemia, lymphoma, and they're fantastic for regenerating organs in the body as well. You can regenerate heart cells and liver cells. You can regenerate your pancreas and even your lungs. Stem cell therapy is limitless. Now, stem cells are used in medicine because they can turn into any cell in the adult human body. So they have the ability to repair and replace and regrow those parts of your body that have worn out over time. They work especially well on degenerative joints like hips, shoulders, knees, backs, even ankles. So those of you out there with knee pain, you probably know what's causing your pain, right? You've seen your x-rays and you know, boy, that space in between my bones where the cartilage sits, it's wearing out. Now, stem cells don't just mask your symptoms of pain. They actually help regrow and regenerate and repair that cartilage and bring new life back to that area so you can start to do the things that you need and want to do again, but without pain. So regenerative medicine is important for you because once your body starts to degenerate, it doesn't stop. So if you think of the area in your body that bothers you the most, maybe it is your neck or your low back, or if it's your knees or your hips, there was probably some time in your life that you injured that area. And from that time on, that joint has been breaking down in your body and it won't stop unless you regenerate it. And now for the first time in your lifetime, you have the ability to do that utilizing this amazing therapy called stem cell therapy. So let's talk about you. You're going to get a survey at the end of this workshop, and if you fill it out and bring that into the office, we can do a specific one-on-one consultation with you about your health problems. So you may have problems like neck or low back, or maybe it is your knees that are wearing out or your elbows bothering you. So really think about, if this was a magic wand and I could wave it over you, what areas of your body would you like improvement in? Now, I don't want you to think, well, my back's not as bad as my husband, so I'm not going to put that on the form. I'm talking about any area of your body that's bothering you. Why would we want to know that? Because stem cells can regenerate any area of your body and get it working like it should. So I really want you to look at this survey. Now, you'll see questions not only about your health problems, your knees, your ankles, your elbows, your shoulders, what's bothering you health-wise, but I really want you to look at how it's affecting your life. So do you feel like I kind of lose patience with my spouse or my family? Or I'm not as productive at home as I'd like to be? Or I can't remember the last time I enjoyed golf or any hobbies that I like? If this is affecting your life like I think it is, then this is a therapy that could change your life. So let's look at some of those joints that you might have marked down on the survey that we're going to send you. How many of you look at the knee on the left-hand side where there's a nice big space in between there? How many of you wished your knees looked like that? I bet you do, because yours probably look like the one on the right, where the bones are closer together and there's bone spurs. You can almost see in the picture how much pain that person's in. So which knee looks like yours? If it's the one on your right, then you need to come in and let us talk with you, because you don't have to live like that. Now that's what Rob decided to do. He came into us because he was a young guy using a cane because he had knee pain for the last 10 years. And he said, I've tried every injection there is. I've tried cortisone. I've tried the gel injections to lubricate my joints. I even had a nerve block. That's a surgical intervention that puts anesthesia in the joint. Now, just because he didn't feel his knee, did that make the problem go away? You know, and I know that it didn't, unfortunately. So he said, I've tried everything and I don't want surgery. Now, a buddy of his came in and he said, I got great results. So Rob decided, you know what, I'm going to give it a shot. No pun intended. And he came in and he got his injection. And he said, you know what, I'm pain-free for the first time in years and I don't have to use a cane anymore. That really gave him hope and it really helped him feel like he made the right decision. So for those of you that have back pain, on the left you can see a normal back. Now in between each of the bones is a disc. That's the cushion, the shock absorber of the spine. On the right though, if you look at the lower part of the back, you'll see that those bones are too close together, putting pressure on discs and nerves, causing muscle and joint pain. Now which back do you want to live with? Well, if it's the one on the right, if that's the one that you have, good news, because you could regenerate your back as well, just like Terry did. Now she came to us and she was a little nervous because she thought, oh my gosh, you're going to be injecting something in my back and I'm worried about the pain. But she said these injections were painless. I didn't even feel them. And for the first time in years, I don't have back pain anymore. Now, July 3rd of 2016, I broke my back. I couldn't move. I had to lay in a hospital. I had to be flat for a month and I had to wear this big brace that prevented me from being able to bend, but it gave me the ability to walk upright. Now, I suffered for 6 months with pain so bad in my hip, I couldn't even pick up my leg. Every time I got in the car, I had to grab my leg by the pants and try to lift it up to get in my car, and that didn't really do much. Just severe pain in my right hip. Those of you with back pain, you know what I'm talking about. The simplest of movements is very painful. So one day I decided, why am I suffering? Why don't I get stem cells? I tried the traditional medical way. It didn't give me the relief I needed. So I got injections on a Thursday. I treated patients for the rest of that day. And then on Friday, I went to get in the car to go on a road trip. And I lifted up my leg and I had no pain. And I thought, no, this can't be that easy. So I did it again and again and again, trying to wear out my joint, thinking pretty soon I'm going to feel that pain. And I haven't. And it's been an entire year so far, and I haven't felt that pain at all. And I'm very excited to share that with you because it gave me my life back. It was wearing me out, and now I can bend, I can move, I don't have any pain anymore. And that's what I want for you.
And center up your necklace real quick. It kind of got off to the one side. Not a big deal.
Right. No, I appreciate that. Okay.
Okay, you look good.
All right, thanks.
Great, actually.
Thank you.
Okay, and action.
So here's a slide that shows some x-rays of hips. On the left-hand side, you'll see a hip that has a nice big space between the ball and the socket. And that's what we want for you, because that hip is going to help you get in and out of your car better, play golf, climb the stairs, get on your floor and play with your grandkids. Now, if your hip looks like the one on the right, where the bones are touching and it's grinding and it's painful, you know what that feels like and how intrusive that is, not to mention painful. And not much option. Hip replacement is pretty much all that's offered to you until now. Which shoulder do you want to have? Look at the one on the left. There's a nice big space between the ball and the socket. But on the right-hand side, you'll see that those bones are so close together that this person moves their arm like this. They can't even lift their arm like you and, well, hopefully you can, but like I can. They can't even lift their arm because that ball and socket doesn't move properly. Now, we all know what's going to happen with that degeneration. You're right, it's going to get worse. Doesn't get better on its own. You have to do something about your health, because whose responsibility is your health? It's yours, you're right. There's nobody else that's going to come up and do it for you. But now you're watching this webinar, and this could be a life-changing decision for you. So how long have you had your problem? Has it been only a week or two? Or like many people that have come to the workshop, have you really been suffering way too long? Now, if you have kids or grandkids, I know you wouldn't let them suffer as long as you've been in pain. But if you're like most people that come to our workshops, they say, I've been in pain 10, 20, sometimes even 60 years, and it's no longer necessary to suffer like that. How often do you get it? Is it only once or twice a year? Or like many people, is it weekly or even daily? If it's affecting your life on a daily basis, it's very hard to be excited about life. People tell me, I don't know what I'm going to do if this doesn't work, because they're miserable. Well, the good news is it does work, and I'm here to show you not only on my body, but on these x-rays that we're going to see coming up as well. When it's at its worst, how bad is it? 1, not much pain. 10, the worst pain that you've ever felt. Now, sometimes people say, well, it's only a 5. Well, that means 50% of your day you're in pain. How much more could you be doing if you weren't in pain all day, every day? If it wasn't wearing you out, causing you to not be able to enjoy the things that you need and want to do. Like many of people that come to the workshops or that come into the office, are you feeling discouraged? Have you been told, like many doctors say, well, you just have to live with it, nothing can be done, or that it's your age or the weather? How do you change that? Well, the truth is you're not just getting older. Arthritis is a problem not of time, but of degeneration. If you've been told you have arthritis or you have degenerative joints anywhere in your body, there was a point in your life where that area of your body was injured. And now over time, it's broken down to the point where you're starting to feel it and notice it. Now, my purpose is not just to come to you and bring this information and deliver a great workshop. My purpose is to help you. But I can only help you if you'll let us. And the best thing to do is to think, you know what? You could get a new you, but you have to do something about it. Don't think, well, my doctor said there's nothing I can do, or everyone in my family has it. To feel better, you have to think differently. Now, how many of you, if you saw this service engine soon light come on, like you see on the screen, how many of you would just ignore it, cover it up with duct tape and keep driving? Well, I know there's 1 or 2 of you out there. Yeah, I see you smiling. So I want you to know what's going to happen to that car that you won't take care of over time. It's going to break down. Now, what if that was your body? What if that service engine soon light was your back pain? What's going to happen to that over time? Well, you could probably tell me it's getting worse. Now I have pain down my leg. It's hard for me to walk. I can't sleep very well at night. I know it might be nice outside, but I can't go out and enjoy myself because I have so much pain in my body. Well, I want you to know that symptoms are a warning sign that something is wrong. It's not something to be covered up with medicine or ice or just ignore. It's something that will get worse. Now, I know you'd check your car, at least most of you would. How many of you think your body deserves better care than your car or your house or your things? Well, I hope that you're nodding your head in agreement because we only have one body and we have now an opportunity and a way for you to take care of that body. And that's what we're talking about today. Because really, what are your options? Well, number one is you could just ignore the problem. You could keep doing whatever it is that you're doing right now. How's that working for you? Probably not very good. The second option is you could take more medicine. Anybody want more medicine out there? Now, one gentleman at our workshop raised his hand and I said, "You want more medicine?" And he said, "No, I already have 18 medicines." He said, "What am I going to do with one more?" So obviously it's not a lack of medicine that's causing your problem. Now, you could always have more surgery, but does anybody really want to have surgery? We want to feel better, but most people don't want to have surgery. So then the fourth option is you can regenerate your body using one of the procedures we're going to talk about today and literally turn back the hands of time. How many of you do remember being a teenager and being able to eat what you want, beat up your body all day, stay up as late as you want, sleep a couple hours, and feel great the next day? Well, if you can't even remember that time, then this is the therapy for you because we want to get your body working properly again. Now, some of you out there might have already had knee replacement surgery. So you know if you did. And if you didn't, well, you can see the picture on the screen of what it looks like. And what they actually do in knee replacement surgery, if this is your knee joint, they cut off your bone and they pound in a new top of the knee and the same thing on the bottom. And then you'll see in the picture that you also get a new kneecap. Now you also get those big scars in the bottom picture right there. As you can imagine, it could be quite painful to have this therapy done. And it's about 3 to 6 months of healing and rehab time. That's provided you don't get any infections or have any setbacks. And there's no guarantee of results. It's illegal to guarantee results of any medical procedure in the United States. Whether it's surgery, stem cells, or any prescription medication, it's absolutely illegal. Now, there's a high percentage of failure and complications with these surgeries. About 50% or more people need additional surgery. How many of you out there know somebody personally who's had more than one surgery on the same knee? Well, we had a gentleman that came in, he had 9 surgeries on the same knee. I don't know about you, but I would be thinking after the second or third one, am I really gonna get a benefit from having more surgeries? But he did, he came in and he said, I haven't gotten the relief that I need, and I've had 9 surgeries, and I'm hoping this is the therapy for me. Well, he's 93 years old, and all he wanted to be able to do was go dancing, country line dancing with his girlfriend, and she could dance a lot longer than he could until he got this treatment, and now he's out there dancing with her. Well, the good news is that you have another option now. You don't have to have therapy. Now, on your screen, you'll see a picture of spinal surgery. I don't know how many of you have had your back fused or had some of this hardware that you can see on the picture here, but if you did, you'd probably be like many people that I talk to and say, I didn't really feel as great after the surgery as I thought I would, or now I have another problem. Because what happens when you fuse 2 bones in the spine together that should be flexible and mobile? Well, I'll tell you what happens as you lose that motion there, the joints above and below those areas, they start to break down too. And then guess what many people end up having to do again? You're right, more surgery. So we would like to help you avoid that in the future if you'd like. Now, how many of you have shoulder problems? I know, don't raise your hand, right? Because that's too painful. But the good news is that you don't have to be satisfied with this 43% improvement that many surgeries offer, less than 50%. We can now find the cause or causes of the problem in your shoulder and get the injections right in those spots while you're awake, while you're moving. We'll be able to talk to you and find out exactly where it hurts, not just go by what an MRI says or just go by what we might see on X-ray like many surgeons have to do. Speaking of surgery, those of you that have already had surgery, you've signed a form that shows many of the risks like you see on your screen here. So the risks of any surgery, you could have bleeding, you could have blood clots, you could have infections after surgery. 1 in 400 people die 30 days after a total knee replacement. Yet that's a pretty routine surgery that many of you out there might have already had. To me, that's not okay. So if you're one of those people that makes it through surgery, then unfortunately you might still have problems, like relying on heavy-duty, highly addictive pain medicine like narcotics, opiates, which can literally ruin the rest of your life. Or maybe you're taking non-steroidal anti-inflammatories like ibuprofen or Advil or muscle relaxers. Now, as you'll see at the bottom of this slide, that's right from the Journal of Orthopedic Medicine. The people that are doing these joint surgeries, they're saying this is the best that we have. Now, how many of you know that painkillers and anti-inflammatory medication are something that you're not supposed to take every day? You're probably nodding your head like I am because you know it's only supposed to be something when you're having a problem. But what if you're one of those people that has the problem every day and you either have an option of taking medicine or being in pain? Well, if you Google ibuprofen, you'll see up to 1 million people are dying every year from this simple over-the-counter pain medicine. Well, you'll notice at the bottom of the slide that this information is from Stanford University. And at their School of Medicine, they're also studying stem cell therapy because doctors know there has to be something else out there. And there is. It's something that's been in us this whole time. Have any of you had cortisone injections? I know many of you have, if you're like the people that come to our workshops and visit us in the office. And now you probably know the answer to this, but can you have as many as you want in a year? You're right, you can't, because doctors know this very powerful pain medication, while it's injected into a joint that's breaking down and causing you pain, it might give you some pain relief, but it also speeds up the breakdown of your joint even faster. So while it's supposed to be helping you with pain, it might be even causing a bigger problem. So if you can avoid cortisone, then this might be an option for you. Now you'll see on this slide that this doctor is telling this patient, hey sir, we've tried everything that we have. One last ditch effort is to try a natural alternative medicine that has a 96% success rate. Kind of backwards, right? Well, if you're like this patient who's tried everything, then this is the therapy for you, because 80% of the people that have this treatment nationwide get improvement. 80% and no side effects. Now, what is a stem cell? You'll see on the screen that a stem cell is a cell that's actually already in your body, and it has many amazing capabilities. On the right side of your screen, you'll see that it has the ability to replicate itself, and that's what it does to keep the numbers up. It keeps reproducing itself. And on the left side of your screen, you'll see that one of the main jobs of stem cells is to reduce inflammation in the body. When your body has inflammation, it cannot heal. Inflammation is like a fire alarm going off. The body will have to handle that inflammation before it can ever start healing. So in the presence of inflammation, you don't get improvement. But with stem cell therapy, the reduction in inflammation occurs quickly. And then your body can build the cells that are at the bottom. You see muscle and bone and nerve, and it can regenerate the cells that your body needs. Now, when you're younger, you have a lot more stem cells in your body than you do right now. And as you age, the number substantially goes down because so many of those stem cells have come to your rescue and helped heal you when you were injured or ill growing up. Now, some of you have already used your allotment, and this is the time in your life you need them the most. Well, the good news is there is an option for you. See, on the chart on the left-hand side, you'll see the people with the most stem cells are newborn babies. 1 in every 10,000 cells is a stem cell in a newborn baby. Now, why do babies need so many stem cells? What's their job? You're right, it's to grow. Now, by the time you're a teenager, you'll see there's a 10-fold drop in the number of stem cells in your body. And I know some of you have already started looking further down on the chart to find your age. So if you're 50, it's about 1 in 500,000 cells is a stem cell. And if you're 60, 1 in 1.2 million cells is a stem cell. And if you're 80, 1 in 2 million cells is a stem cell. So you're thinking, how am I going to heal when I don't have enough cells? Well, I have an answer for you, so stay tuned. So we're going to talk about 3 different sources that you can get stem cells from in the United States. The first is your own bone marrow. You're actually anesthetized to some degree, and then your hip is cut open, and then the doctors use a big needle to get the marrow out of the bone, and from there the stem cells can be processed. Now, adult stem cells are great for making blood. So if you need blood, if you have a blood disorder like leukemia or lymphoma or sickle cell anemia, this is the source that you want to get your stem cells from. But if you need cartilage in your knee or you need to repair a ligament and you put blood in, does that make sense? If you're like most people, you're shaking your head no. Well, the next option is you could get stem cells from your own belly fat. Now, I've done this workshop enough times to know that there's 1 or more of you out there who want to donate for the whole group. And while I appreciate it, they have to come directly from you. Here's the challenge. Number 1 is it's a needle about this big that goes back and forth and up and down in your belly, and it harvests 2 containers of cells about this big. So you won't really look any different when you're done. You'll just have the cells that you need to help regenerate your joints. But the problem is you don't have enough stem cells in your body, regardless of where we get them. If we take them from your fat and we put them in your knee and they weren't doing anything for your body and your fat, why would they all of a sudden wake up and help your knee? Well, you're right. They're not going to do that much. So the third option is a really unique option. Now, how many of you are aware that when a baby is born, the sac that a baby grows in is just thrown away? It's medical waste after they're born. Well, we work with one of the 49 different tissue banks in the United States, and they've actually investigated this more. They've looked into this sac, which is normally just thrown away, and they've said that sac is loaded with all the cells that just grew a whole human being. So those cells can actually be used to help your body. Now, there are several very serious criteria that the mom and the baby both have to meet. Number one is that the doctor has to make sure that the mom is going to have a scheduled C-section because they don't want to damage the tissue. Number two is the mom can't have any genetic problems because we wouldn't want to pass anything on to you. She can't have any mental health problems. She can't have any infections or diseases, no medication, not even a tattoo. Now, once the baby is scheduled for a C-section, the tissue bank is invited into the operating room. And once the doctor says the baby is healthy, only then is the placenta given to the tissue bank. And then they put it into quarantine, where it's stored for a period of time and then tested. If there are any problems, they discard all the tissue. If it makes it to production, then during that production of the product, there are several different layers of testing, looking for infections, diseases, things that could be passed along to other people. If the tissue doesn't pass, all of the tissue is discarded from that placenta. So before it's sent to us to be used for you, the tissue bank actually tests one sample from each batch and makes sure that it's safe to send, and only then does it make it to our office to be used for you. Now, this is not Planned Parenthood. This has nothing to do with babies. There's no DNA in this at all. It's just literally medical waste that can be used to help your body. Now, I'll tell you more about how it works as we go along. And that's what Susan did. She came to our office and she said, listen, I was injured in a car accident and I tore my bicep tendon in my arm. I injured my shoulder and my neck. And so like many of you, this car accident really messed her up. And she went the traditional route. She was on pain medicine. You can see it left her feeling groggy, like she was going to be addicted. She tried physical therapy. And for 3 or 4 months, she was getting worse, worse, worse. She said, I was left feeling like pain had to be a part of my life forever. But she decided that there must be something else. So she came to our office and she decided that she was going to get an injection in her shoulder blade. And she said, I almost felt an immediate relief. And from there, she just continued to get better, better, better. She regained not only her strength in her arm, but her sensation. She didn't have pain anymore. And she was so grateful for the improvement, as many of you will be. Now, in the United States, we have a regulatory agency called the Food and Drug Administration, and they have 2 rules with regard to stem cells. Number 1 is you cannot manipulate the stem cells in any way. What that means is you can't add in anything that makes them work better. So remember, they're not working all that well in your body as it is right now. That's why you're feeling the pain and having the problems that you are. So not adding in those growth factors that we had when we were teenagers and felt invincible and could really do whatever we needed with our bodies is like planting a seed without having water, soil, and nutrition. Would you expect that seed to grow? Probably not. So the other thing, speaking of growing, that you can't do to stem cells in the United States is you can't grow them. You can't make more. You can't regenerate or rejuvenate them, because remember, your stem cells are lazy. They've gotten to the point where they've helped you so much, they're saying, hold on just a minute, let me catch my breath. I can't do what you need me to do. And that's why you're feeling like you're feeling. So in the United States, using your own cells doesn't really give you the best results. But what does is using amniotic tissue that we talked about from the sac that just grew a whole baby. Now, why does this work better? Well, number 1 is it has all those growth factors that you see listed on the bottom of the screen there. And number 2 is it's loaded with a type of cells called cytokines. What cytokines do is they pick up the message that your injured joint is sending out to your body, kind of a chemical SOS message. And those cytokines, they pick up that message and they tell the stem cells where to go and what to make. They drive them right into that area. If the chemical message says, I need cartilage. That's what the cytokines tell the stem cells to make. They say, I need bone or I need nerve. Then that's what they tell the stem cells to make. Now, the good news is that once that chemical SOS signal shuts off, when the joint is healed, the cytokines, they back off. And then that way, the joint doesn't continue to get bigger, bigger, bigger. You don't want your one knee that you got stem cells in to be bigger than the other. So there's a built-in shut-off mechanism that makes this foolproof. Now, for repairing your joints, your own bone marrow and your fat are not ideal. Why? Because remember, you have low numbers of stem cells. In the United States, we can't grow them out. In Europe, you could pay $60,000 or $70,000, and they would remove your bone marrow and they would grow it and they would add what you needed and then they would inject it back into you. But if you don't have $60,000 or $70,000, don't worry, because I have a much more affordable solution right here in the United States. Now remember, your own stem cells, they're low in those cells that pick up that chemical SOS message that your injured body parts are sending out. You don't have enough of those cytokines to really drive those stem cells to the area and make them do what they're supposed to do. You're missing those growth factors that you had coursing through your body when you were a teenager. And unfortunately, all those things get worse the older that you get. Now, it costs a lot more to harvest your own stem cells in the United States because it's not just a one-time thing. Because remember, we can't change them in any way. So you have to have multiple injections, harvesting from your hip or your belly fat. It can be more painful. It's just not ideal. But I do have a solution for you that is. We've known that the amniotic tissue, that sac that I talked about that the baby grew in, we've known that that's been used for decades across the world. But in the last couple years, it was allowed into the United States because President Obama let it in. Since that time, there's been almost 1 million injections done without one adverse reaction. How is that possible? Well, this specialized product that we use doesn't have any cells in it that can trigger an immune response or any adverse reaction. The American Association of Tissue Bank is regulated by the FDA, and they have very strict guidelines in place regarding processing and storing and the way that it's delivered. So we want to make sure that you feel comfortable that there's nothing that's going to get in the way of you getting better. And that's why Robert came to us, because in the past, like many of you, he had had surgery. In fact, he had both his hips replaced and his right knee. Well, he came to us because for 8 or 9 years, his back and his left knee had been bothering him. When you have a problem on one side of your body, where do you put all your body weight? On the other side, that's right. And when you come in and we x-ray both of them together, that's the side we find more problems on, believe it or not. The one that's the good side. Well, Robert came in and he said, I don't feel like I have a good side left because I'm in so much pain and I don't want surgery again. I've done it and I don't feel good. So I wanted to get these injections, and he got them in his back and his left knee. And he said, my left knee in a week and a half, 10 days, feels 80 to 90% better with very little pain. And my back's already 50% better. You know what? He told about 20 of his friends because he was walking and moving so differently. They all were saying, what'd you do? So he started telling them about stem cell therapy. Now, the tissue that we use is safe, clean, and effective. We don't want to leave anything to chance with your safety. And that's why Linda decided to do it, because she came to us after suffering with back pain for 25 years. Now, I know there's some of you out there that are suffering longer, or that maybe you're thinking, I could never wait 25 years. Well, the good news is you don't have to, because just like Linda, you have the opportunity to get this life-changing treatment. So she came in and she said, my pain level went from 10 out of 10 to a 1 out of 10 in 10 days. My back feels so much better. Surgery wasn't an option for her. She did not want to do it, and she thought, I'm going to try this and see. She said, I really hope that my testimonial helps more of you out there because it worked for me. Just like it worked for me, and it worked for the thousands of people all across the country who have done this type of therapy. Now, what are the pros of this amniotic tissue? Number one is you get reduced or eliminated pain, which is what you want. You don't want to suffer anymore. Number two is you get your life back. You get to do those things that you've been putting off, like travel or dancing or spending time with your family, or maybe even just enjoying the ability to get up out of a chair and start walking without hanging onto something and having to wait for your knees to clunk in place. I'm talking about not having to spend money on pain medicine anymore. Think how much money you could save by not having to invest that every month into yourself. And it's one injection in your knee, one injection in your hip, one injection in your shoulder, one time. That's it. And then your body takes over and does the rest. So look what this tissue could do for you. Your knee probably looks something like the one on the left-hand side where the space is too close together. And on the right-hand side, look at that big dark space in between those bones. That's what stem cell therapy could do for you. On the left, you'll see a patient before they had the injections in their knees, and you can see, like many of you, that the space between the bones is too small in both the knees. Now, if you look on the right, look at the dark space, look at the increase in size, and you look at the top of the slide, that was 8 weeks. 8 weeks, 2 months, and you could start regenerating your joints too. That person on the right, they're moving, they're enjoying the things that you want to do that they had put off for so long, and that could be you. Now, if you look on the left-hand side of this slide, you'll see they actually measured the space. The inside of the knee on the far left is 1.6 millimeters. Now, in the after slide on the right, you'll notice that that knee space has gone to 2.7 millimeters. That's a big increase in space. They can now move their joints like they're supposed to. The other knee also made similar improvements and big increase in space. Now, if you have a shoulder problem, like this person on the left had, where they had hardly any space between the ball and the socket, look at their changes. It almost tripled in size on the x-ray on the right-hand side. And you'll see at the top of the screen, that was 24 weeks. Now, shoulders are some of the toughest joints to make changes in because there are so many different areas involved in your shoulder. It's not just the ball and socket. It's your neck, it's your chest, it's your arm, it's your upper back. All these areas are considered before we do a treatment on you because we want to help you get the best results as quickly as possible. And Jane came into us because she had a knee problem like many of our patients do. Hers had gotten so bad though, she couldn't even walk for 5 minutes. She had debilitating knee pain. She actually just walled off the whole top of her house, moved her bedroom downstairs. She said, I can't even climb the stairs, so I'm just gonna live in my first floor. Well, she went to an orthopedic surgeon, and like many of you, he suggested that she get knee replacements on both sides. He said it'll probably be about a year before you start feeling better. You're gonna have some rehab to do. And she thought, you know, maybe there's something else before I do this. So she came in and she got an injection. And it's been 5 months since she got her treatment. Not only can she go back upstairs now and sleep up in her room, but she can walk and bend and move. The things that she wasn't able to do for so long before, she can do without pain. And that's what we wanna help you with as well. This is a simple one-time procedure that takes about 15 minutes to do. And within the first 24 to 48 hours, your body starts to regenerate blood supply in that area. Now, like most of you know, blood brings oxygen and nutrition to the areas of your body, and it removes waste products like inflammation. That's how you're able to start getting changes and healing so quickly. Within the first 24 to 48 hours, many patients report feeling less pain and discomfort. Now, there's no surgery and there's no downtime. You don't have to carve out a week or a month or a year of your life to recover. You don't have to go to the hospital and have surgery. Come into the office and it's a quick procedure that starts healing. Your body starts healing right away. So while you're walking out of the office, you're already starting to heal. Imagine that, not feeling worse after the procedure. Now for joints, this amniotic tissue is what you need. It's the thing that can regenerate your joints, but we have to find out what's right for you because there is another option as well, and that is a very specialized treatment using your own belly fat. Now, I know I told you belly fat wasn't good, but this company, they perfected a technique that could help your body regenerate itself using something that you find to be a nuisance right now. Now, I'm talking about advanced therapies with fat, using the proprietary system that Advanced Stem Cell has come up with. We partnered with Advanced Stem Cell out of Florida because they have a very unique system using your own belly fat to help heal parts of your body that are broken down or worn out, or other internal conditions that many of you watching this might have, like diabetes or neuropathy where your nerves are dying, or even breathing or heart problems. So why do we use your belly fat when I just told you that belly fat was not as functional as using this amniotic product? Well, actually, we have a proprietary system that allows us to get more stem cells than most people would be able to get right from your belly fat. Your belly fat has 500 times more stem cells than your bone marrow. It's a lot safer and way less painful to harvest your belly fat than it is bone marrow. And your belly fat stem cells have undergone less aging than those in your bone marrow. These are just some of the conditions that your own belly fat stem cells can help you with. Conditions like autoimmune diseases, where your body's attacking itself, like lupus, I'm not even going to go into that. Conditions like autoimmune diseases, like lupus or scleroderma, where everything's tightening up in your body, fibromyalgia, even rheumatoid arthritis. We all probably know somebody who has the distinctive changes in their joints and their hands. It's painful for them to use their hands. They don't have the grip strength that they need. Imagine intervening in that person's disease process and helping them get improvement. What would that mean to their life and to you for helping them? Conditions like neurologic problems, like Parkinson's. We all saw Muhammad Ali and Michael J. Fox dealing with this. Cerebral palsy. What's the treatment for cerebral palsy? People watch their loved ones just literally deteriorate before their eyes. But we have had people across the country who are regaining the ability to use their body to a large degree and able to start communicating with their family again. That's priceless for them. Conditions like Lou Gehrig's disease, which is a progressive nervous system disorder. Stroke. Many people know someone that has had a stroke and they've lost that loved one to a large degree. This can be something that can help get them back. Even conditions like MS. You no longer have to wait for that person to end up in a wheelchair. You can make a change. They can make a change today. And even things like neuropathy, where the nerves in your hands or feet are dying. That's a painful condition that causes people to lose their ability to live properly. And this can help with that. Conditions like digestive problems. We think, well, they just have to go to the bathroom a lot. What's the problem? But if you ask somebody that has one of these conditions that are listed on the screen, they'll tell you that it's way more than that. It affects their energy. It affects their immune system. It affects just their own personal sense of self-worth because their body doesn't work like it should. It's no longer necessary for them to suffer. Heart and lung diseases, this is becoming the gold standard of treatment is stem cell therapy. People with congestive heart failure, people that have plaquing in their arteries. P.S. We all have plaquing in our arteries. Breathing problems and even blood flow issues are being improved significantly with stem cell therapy. And other diseases like diabetes, type 1 and type 2. So not just people that I have to monitor my food. People that have to take insulin to survive are changing the way that their body is working, are regenerating their pancreas, that part of their body that's injured. That's exciting. Do you think that's exciting? I do, and so do a lot of people that we talk to and get these results. Disc disease, you can inject this, you can inject your own belly fat stem cells right into your disc or where your disc used to be and regenerate your disc. ED, baldness, autism, liver and kidney disease, all of these conditions are responding to people's stem cell therapy using your own belly fat. Now, the greatest doctors in the world don't have a cure or any meaningful treatment for half the conditions that we just talked about. But now the treatment has been right around your midsection this whole time. Now here's a gentleman in this picture who actually you can see already lost a toe to diabetes, and he has a big open sore on his foot. And so what the doctors are doing is injecting his own belly fat stem cells into his leg to help with his blood flow. You'll see on the left-hand side where it says before that the black line is the blood vessel. And you'll notice that it really doesn't go all the way down to the foot. That is the big reason that he lost his toe already is the tissue just died. But look on the right where it says after. Look at all those black lines. Look at how much blood supply has been regenerated even down to the toes. That's what we want for you. It's no longer necessary to have the problems that you're suffering with. You'll notice on the left, the blood vessel is now in white and it stops again right at the ankle. Not much blood supply to the toes. But on the right-hand side, 8 months after stem cell therapy, this person has a strong, strong artery all the way down to their toes. No more amputations for them. Now maybe you're thinking, I just wanted to see what this was all about. I'm pretty healthy, and what about staying that way? What about preventing your own body from breaking down? Well, you can get your own belly fat stem cells harvested. They can be injected into your arm a couple times a year, right into your bloodstream to keep down inflammation, to prevent you from getting the conditions that quote unquote everybody seems to get. You can keep yourself healthy and continue to stay like that for the rest of your life. Now, How many of you, if you woke up tomorrow and you had no pain, would think, you know, I must have died overnight. Maybe I'm in heaven or something. It's been so long since I've been pain-free. But what if tomorrow you woke up and you had no pain and you had tons of energy? You got out of bed, you started walking right away, you went downstairs, made your coffee, cooked your breakfast, came upstairs, you had energy, you had no pain, you got ready for the day, you had a whole day of doing whatever it is that you wanted and enjoyed. Came home at night and still had energy, still no pain. You could stay up until you were ready to go to sleep, and then you slept like a baby. You slept all night long, you didn't wake up once. How many of you like that day better? Well, I'm with you. I like that day better. Now, if you're somebody thinking, that sounds like a dream, but I don't know how to get there. Well, the good news is we do, so stay tuned. Because your healing starts with one decision, and that is, you know what? I'm worth investing in. I had to make that decision for myself. For 6 months, I tried what the doctors told me. I had horrible pain in my hip. I didn't have a quality of life like I did before I was hurt. And to them, I was just gonna heal because I was young. And I thought, you know what? I'm done with that. I know there's something better out there. And that's why I made this decision. The time is now to make that decision for yourself. Because unfortunately, no one's gonna come to your door and knock on it and make that decision for you. Only you can decide that you're worth investing in. Because if you don't do this particular procedure, if you don't put more stem cells in your body, the treatments on the screen are what you have left. You have more drugs, more steroid injections, surgery, maybe multiple surgeries and more recovery drugs. You have to decide what you want for your life. Because I'll tell you what, life without those conditions and life without those treatments is so much more enjoyable. And that's what I want for you. The choice is yours. You can keep doing what you've been doing this whole time, or you can decide that you want to start your life over and regenerate your body with stem cells. Now, there's 4 reasons to get these injections done. Number 1 is they only work if you get them. You've learned a lot of information during the workshop, but the only thing that works is actually getting stem cells injected into your own body. And really, how bad does your health have to get? Do you have to be using a walker or a cane, or do you have to be confined to a wheelchair? Or maybe you're already somebody who can't even leave their house. You just like to be in the dark because you're in so much pain and you're miserable. Well, guess what? You don't have to suffer anymore. Now, life's about happiness and living, and we aren't put on this earth to be in pain and be miserable. You have an opportunity to get your life back right now. And we've all agreed that there's nothing more important than our health. It's not a car, it's not a trip, it's not stuff. It's actually getting your health back and spending time with the people that you care about and that are missing you, that are wondering what to do to help you. They're hurting too. So if you won't do it for yourself, do it for them. So what we want to do is give you a gift, and that is an opportunity to come to the office at no charge and spend up to an hour with us to find out whether or not this therapy is right for you. Now, when's the last time any doctor's ever given you up to an hour of their time at no charge? Well, if you're like me, the answer is never, and I'm a doctor. But the reason that we do it is because we want to take away any barriers to finding out whether or not this is the right therapy for you. So we'll do a consultation to find out what's going on with your health, and then we can schedule an exam to find out why you're having the problems that you're having, and you might be able to get the treatment that same day. The same day you come for this free consultation, you could get your treatment. Now, I'm going to handle some of the frequently asked questions that I know you probably wrote down on your paper because I've done this lecture over 2,000 times. And I know that people have these questions, so I'm going to handle them right off the bat for you. The first question I know you have is whether or not this is covered by insurance. And the answer is it's not covered by any insurance. Now, I know your second question, why? Well, we asked the person that is the head of a major Chicago-based insurance company that same question when they came to us for their own stem cell therapy injection. And they said there's 2 reasons. Number 1 is lobbying, and number 2 is funding. And they said what that means is, do you think that if people need less pain medicine and less surgeries, that might affect other areas of medicine? What do you think? Well, you're right. Those areas that you're thinking of, those are the people that lobby and provide the funding to get certain services covered by insurance. Now, people ask us, well, when's the FDA going to get behind this? So we asked our tissue bank to ask the FDA because they're in the tissue banks on a regular basis. And they said maybe 10 years we would start to look at this. And then it's going to take about 5 years to get this pushed through and covered by insurance. So now as the person watching this webinar, that's sitting there with pain, that's tried everything, that's suffering on a daily basis, you have the choice. You can roll the dice with your health and you can wait up to 15 years to make sure this is covered. Or, like many people watching, you can make the decision right now that it's time to do something about your health. Now, the good news is this procedure isn't $50,000 to $70,000 like if you go to Europe. It's not even $40,000 or $20,000. The procedure ranges between $4,000 and $6,000 for a joint, like a shoulder, a hip, a knee, and between $10,000 and $12,000 for your neck or your low back. So what's the value of the gift of health? Well, your health is priceless, and this will not cost you one penny to come in and find out whether or not the condition you have is something that could respond to stem cell therapy. Call the number at the bottom of your screen. Give yourself this gift. We want to help you. Your friends and family care about you, and I know you're tired of being in pain. So call the number and schedule a time to come in and meet with us and get your life back.